Hi, guys. Welcome to Chemo Glow, where the glow doesn't define me, I define the glow. It's November, guys, and November is Lung Cancer Awareness Month. I bet you didn't know that. Lung cancer accounts for more deaths than any other cancer, more than breast, prostate, colon cancer combined. My guest on this podcast today is Tomma Hargraves. She is an almost 14-year lung cancer survivor. This podcast was riveting. It was interesting. There's some things that you're going to find out, not just about her, but about lung cancer and lung cancer awareness. Please tune in, listen, and I hope you enjoy. Hi, guys. You're listening to Chemo Glow, where the glow doesn't define me, I define the glow. So excited about my guest today. Oh my goodness. Before we even started to record, I had to catch up with her to find out how we met, because it's been a while now, what she's been up to. And the world today is just like in a crazy frenzy. So we had time to chat before we went on. But I would like for her to introduce herself, and then we're just going to get started. And remember, this is a very laid back recording. So just keep it coming how we were doing it right before we hit record. So go ahead.
Okay.
Yourself.
Okay. So hello everyone. My name is Tomma Hargraves, and I will soon be a 14-year lung cancer survivor, and treated at UNC Chapel Hill. So I will try to make my story brief, but I was diagnosed with no symptoms when I was 58 years old, and I did shop for my treatment because I was really mad, because I was very healthy, and I was really mad that I got diagnosed with lung cancer, and ended up going to UNC because they offered me a clinical trial. Now, the lung cancer treatments that they did back 14 years ago are nothing like they're offering now. And I was just really lucky. I ended up having a pretty aggressive treatment with chemo, lots of radiation. And then I took a targeted therapy drug, which was brand new to the market. As I understand it, it wasn't even approved by the FDA at that point. So 9 months later, after all that treatment, I lost my hair. You can see it came back this way. So pretty much the oncologist at UNC, what was there is essentially gone. It was fabulous. It was not an easy treatment. I will admit that. And then I was good for about 3 years. And then I went out of remission after 3 years. And it was interesting because where it came back, I did have one met to the brain, but it came back in a spot right here in my neck, not in my lung, but in my neck. And that's where my original lymph node, that's how I found I had cancer, because I had a bump there. So I had more treatment. I had radiation to the brain, just one treatment, more chemo, more radiation. And essentially, since then, I have been doing quite well. And I continued to work through almost all of my treatments. I retired 6 years ago. I'm a speech pathologist. I worked in the educational setting for 42 years. Yay, congratulations.
42, goodness.
40. So I got through that. And after I retired, I had decided there is a reason that I survived a really bad cancer. So, and that's how Regina and I got to know each other.
Yeah.
We got essentially involved with the Patiently Navigator program that they were starting at UNC. It has kind of morphed over the years. And then, of course, Regina decided to have these little twin girls.
Yeah, it was time for me to take a quick breather.
Yeah. And you know, I'm the grandmother stage here. So I volunteered to get involved with the program at UNC. So that's what I'm doing right now. I'm called a volunteer lay navigator. And right now, I'm working with patients by phone. We're not allowed to go in the hospital with the COVID. Up until 6 or 8 months ago, I was going into the hospital and actually working in the thoracic oncology clinic, primarily with lung cancer patients, but also some head and neck patients also, and actually working with my own nurse navigator and my oncologist. I have learned so much about lung cancer just being able to be in there with them. But so that's what I've essentially been doing since I retired. I'm also involved in some other things, which I won't talk about right now.
We might touch on those.
I'm active. I'm active for social justice. I will say that. So, and my husband is a retired Santa Claus. You might have seen him at the cancer hospital at UNC. He actually had a Carolina blue Santa suit, but he has Parkinson's now. So my caregiving, when he finished being a caregiver for me, tables have turned over the years, and now I'm a caregiver for him. And he's been treated at UNC as well. So, and he's had his ups and downs, but right now he's doing pretty well. But the thing I want to say about, in my particular case with lung cancer, the treatments that they have now for lung cancer are so different, because a lot of it's targeted therapy, a lot of it's immunotherapy. And in my particular case, they weren't even testing for mutations or biomarkers way back then. Well, guess what? 3 years after I got diagnosed, they found out I had EGFR mutation. And so the targeted therapy drug I had during the clinical trial was developed for that particular mutation. We didn't even know it at the time. And now that's not even one of the frontline treatments anymore. So, but we don't know why what was successful with my treatment. I mean, my doctor thinks I'm a really good candidate for radiation. I always say I glow in the dark. I have a lot of radiation. But I think that targeted therapy probably did make a difference too. So whatever worked, I'm very blessed. We know that.
And when you say you shopped around for your care, why was that so important to you about shopping around? How did you know you needed to shop around and make sure you found the right hospital, found the right doctor?
Well, number one, how blessed are we right here in the Triangle and North Carolina with all these fabulous comprehensive cancer centers. But I will admit, I had a fabulous advocate with my son, who is an emergency room doctor in Atlanta, but he was in residency when I was diagnosed. The first thing he said to me was, get to a teaching hospital. That's where the cutting edge treatments are. So at that time, Rex and UNC were not merged like they are now. So I went to Rex, I went to Duke, and I went to Carolina. The Duke people were much more positive. At the time, the Rex people were pretty generic as far as their treatments. So they didn't really offer me anything than standard of care. But then when I went to UNC, and I always joke about my oncologist, who was my original one, is not there anymore, but he's very well known in the lung cancer community. And he also has perfect hair. And so we all, you know, when Grey's Anatomy was out, we started calling him McDreamy because he had this perfect hair. And so, but he came through with what he said he was doing. Now, I will say the clinical trial he offered me, and I decided to go with that because I'd gotten online, I looked at the internet, I knew, I mean, at that time it was probably 12% survival rate for lung cancer people, and I was stage 3B when I was diagnosed. So I thought, what do I have to lose? I could do this, maybe help somebody else. I could not do it and probably not survive very long. So I took my chances on it, and here I am almost 14 years later. But I would have been willing to go other places. But part of that is because I had great insurance,
Mm-hmm.
and I had my son as an advocate, and that really was helpful for me. Yeah.
And great insurance. I'm glad you said that because that makes a difference.
Oh, indeed. Yes.
When I was first diagnosed, my husband and I, we weren't married yet. He was my fiance. My insurance wasn't that great. I was an independent contractor. I was paying for my own insurance. And then when we got married, he had great insurance, which means I had great insurance. And let me tell you, the conversations changed.
Yeah.
Who you went to go see, it changed. It shouldn't, but it did.
That's right.
And we had no problems. And that's what made me want to be an advocate of my care, but also get involved with the PFAC committee, lay navigation. And that's how we met, because you just reminded me that we met at a coffee shop, one of my favorite places to be at, with someone who was starting the program. And I actually kind of worked under you and followed you. And you were showing me how you were going into these rooms. You were amazing. Come on. You were amazing. I was like, I don't know how you can do this. And
but you were very well known, and you were very you were a very well known advocate for breast cancer patients at the time. And so I was so excited to get to know you. And and I remember when you were married, and then you had some heart issues, or what was it? And I was doing my volunteering, and I got to come up and visit you.
Yeah, you came up. I think was my husband there too?
Yes. Yeah, you were.
Yeah, I was so out of it because I think that was the time that I actually went into the cardiac ICU because they thought it was a heart attack, and it was putting stress on my heart and everything. Like, a lot of people don't know, like, all these side effects from different things, or the treatment you're going in. You can die for something else. And I was like, please don't take me out of here for this, for my heart or, blood clots. But yeah, you did come up there. You were up there for a while. You snuck over and
had my little official blue coat. Yeah,
you came right on through.
Well, and the thing is about, and I will add this about doing clinical trials, because I'm a big advocate for that.
Yes.
When they give you all this paperwork on doing clinical trials, and they tell you, and you hear it now on TV, you try these drugs and they list all the stuff that you can go through and all the crap that can happen. And and this oncologist sat down and hand wrote out the treatment plan for me, because when you're diagnosed, you were like, you're overwhelmed with this information. You're just like, what? And it made it simplified me. It didn't make me feel any more comfortable about it, but at least it gave me kind of, okay, this happens first, and this happens, and this happens. And then when you sign off on those papers for the clinical trial, it's like, well, okay, all these other things could happen. Mm-hmm. But you could also survive. Now, I will say the clinical trial I did globally was not successful. Yeah. But there's a few select patients that it has been successful for. And one of them is my friend in Wilmington. So we're not quite sure why that happened. And they didn't go further with the study. Yeah. But there was this subgroup that they survived it. So, and I did run into my original oncologist at an ASCO conference in Chicago, and he called me like, I was a successful person. And he still had the beautiful hair. So
it was so funny at UNC. I know doctors buy their ties, their socks, their hair, like this is something. And then to be able to volunteer alongside the doctors. That's what I like. I learned so much about like the tumor board, and
yes,
really get to see behind the scenes. At first it was a little awkward because I was seeing my doctor, then I was seeing my oncologist, and they were all in there, and they was like, hey, how you doing? And then I really started to get involved because there was an unmet need there. And watching you do, because you stayed on, because the program was a little chaotic when I first came on, and then life happened, and those two little babies kept me very busy.
Gross.
But then I ran into Loretta at our appointment. She's like, "You had the kids, right? You ready to come back?" And I was like, "I can come back in a different capacity if you like."
We really do need more people to do this. It's a very, it is hard. I mean, if people are working, it's a really hard thing to be doing. And now, I can devote a lot of time to it. And right now what we're doing is we're calling patients at home because we can't go to the hospital. And I kept thinking, oh, that's not going to be that great. It's been pretty amazing. Some of them are just so happy to talk to somebody because they're stuck at home. And, nothing worse than having cancer and COVID worries on top of it. So but I really miss having that face-to-face with my patients. And, some of these patients, I've lost patients, and it's hard. It's a hard thing to do. I don't know how the doctors and nurses do that when they lose patients all the time. But I also have gained so much through it with friendships and so it's a good experience. If anybody has the time to do it, I would encourage you to volunteer to do it. I don't know if Duke is doing it or not. They might be. But I know UNC, and the person we have now running the program is through the Patient and Family Resource Center, and she's really good. So
that's good.
Yeah.
Please volunteer your time. I really, I had a chance to give you, I believe it was our Excellence Award from the people.
Yes, you did. I think I was the one and only. We haven't had a meeting since.
I was like, yeah, you were, because COVID happened. Well, your name is now up on a beautiful plaque. All our names are up there, but you really do so much for not just but
if you look behind me right here, there it is.
I see it.
Now, I've been packing up my house because, we're having our house recarpeted, and it's very painful and stressful. And this is the last space that's going to be packed up. So there it is. It's right up there on the bookshelf.
It was my honor. I was like, yeah, I have to do it. And then I went out after that because I had an appointment with the girls.
Yeah, that's right.
But
it's interesting because these things lead you to getting to do other things. Like I'm on a couple of national boards now involved with some things. One of them is involved with Dr. Muss from UNC, but it has to do with geriatric patients. Now, I wasn't a geriatric patient when I got diagnosed, but I am now. And so I'm on this national committee, and we just do our meetings online by Zoom or whatever. And it's about encouraging young investigators to include patients over 65 in clinical trials, because like a lot of times they don't. But, as we know, your true age and your chronological age can be very different.
Yes.
So like, I don't feel like I'm my age. I'll say I'm 72. I don't feel like I'm 72. I may look like I'm 72, but I don't feel like
not. No, you do.
And then I applied for another group that I'm going to be involved with, and it's the International Lung Cancer Research Group. And of course, and I thought, this is great because they have their gatherings or conferences all over the world. Well, of course, we're doing it online.
Yes.
Hard.
Now, there's been a couple of times where you have traveled, and
yes, yeah. I went with, a long time ago, I went with a longevity group, which is a national lung cancer group. And then that was up in DC. And then I went to another one that was in Chicago, and it had to do with, it's the Research Cancer Institutes, and it covered all kinds of different cancers. But they paid my way, and actually the person who was running it was an oncologist from UNC, so she asked me to go. And I learned a ton about that, because about all different cancers. And then I went to another lung cancer one in DC, which then, they do some training, and then we actually go and talk to our legislators in DC, which was eye-opening because none of them were available to talk to us about cancer funding. So we talked to a lot of young assistants. And then I was asked to go to the American Cancer Research Conference, and they told my story as a survivor. And then I went and talked to legislators as well about cancer funding. So it's been eye-opening because we have some people who really are willing to commit to research money, and there are others who say, oh, we'll pass this on, and we never hear from them again. So I'll tell you the one person, and if you're from North Carolina, is David Price. David Price is very supportive of cancer research. So if you're in North Carolina and you're in his district, he's a good person. So
David Price, remember that.
Yeah.
One of the things that I also want to touch on is, I was diagnosed with breast cancer. My mother had lung cancer. But one of the things that I learned very quickly while I was going through radiation, there was a notebook there that they would have people share their thoughts. And I would always, because you had to do radiation every day, like every day you had to do it.
Right.
During the holidays as well. I think we only had Thanksgiving off, and then we had to keep going. But in that book, lung cancer and breast cancer, those two, I seen this one lady who kept writing, breast cancer is not the only cancer. And it happened to be in the month of October. And it's very important that people know that the funding sources for lung cancer versus breast cancer, cervical cancer, how many people are living with lung cancer, how many people are being diagnosed versus living with breast cancer. That's so important. And I like the color pink. I actually don't like the color pink. But I understand the power of pink. So
right.
Is it with the funding sources, or how do you ever feel like lung cancer is being overshadowed by breast cancer or other cancers that are out there in the spotlight?
Well, I do, because, when I was first diagnosed, I didn't even realize that lung cancer is the number one cancer killer of women.
Yes.
Now, more women get breast cancer, but their survival rate is fabulous.
Yes.
Because they've gotten, and I won't take that away from, they've done a fabulous job of getting that research money. And so it's an emotional thing. And I think I congratulate them on that, but it does kind of make us feel bad, because lung cancer is the number one cancer killer of women, and they're the least funded.
Yes.
So if you look at any charts, you will see lung cancer. And a lot of it has to do because we live with a stigma that they think you have lung cancer because you smoked. And that is just not the case. In these last 14 years, we now have, there's got to be 3 or 4 different mutations for lung cancer. And these are young women who are getting it, never smokers. Now, about 20% of smokers do get lung cancer. So what about those other 80%? Why didn't they get lung cancer? My grandfather smoked his entire life, and he died at 91 of being 91. Yeah. So yeah, there's a little frustration there, I will say. I think we're getting a little more visibility over time. But it is, and I congratulate, we always say lung cancer patients want to be where breast cancer patients are with funding. So, and my oncologist said, I think he went to ASCO, and he said, oh my gosh, everybody wants to do lung cancer research now because we're making progress finally. And so I thought, well, this is great. We love that. But and then you have the drug companies, and people see these ads on TV and they think, oh, great, I have lung cancer, I can do that drug. Well, a lot of those drugs are mutation and they don't realize that. So it won't work for everybody. But so It's a little frustrating, and the drug that I had, I don't think they're even advertising anymore. So,
oh wow, it's important that people understand that there is that. I don't know if it's a fight for funding, but it's the stigma. We have a friend who's young, who's never smoked, and I was at a support group. I went to go support her on something, and the first thing that someone said was like, "Well, you were a smoker," and she said, "It doesn't matter. I have
That's right. That's right.
I have cancer like everybody else in here. So I could see her frustration." And when my mom was diagnosed, everybody kept sending her pink stuff. And she was like, one more person sends me something, because no one's asking. Or if they find out, then you deserve that, or something happened. That stigma that's there. And that always bothered me. And the fact that I see that even sitting in radiation, reading and seeing that there's no funding, like pink, the power of pink is very powerful.
It is. And some of the things, when you look at, how the marketing is for pink stuff, I think the one that put me over the edge was the Kentucky Fried Chicken pink box or something. It was like, what? And so, and so we are, sometimes we're oversensitive to that. And so, and I don't wear much pink either. I think a lot of people associate pink with women's cancer, period. And that's okay. That's okay to do that. But, when I say to people now, because I'm very brazen, I'll say, what color is associated with lung cancer? And they're like, I don't know, and it's white. It's white.
Yeah.
Now, there was a group, I can't remember the group that came out. I think it was the American Lung Association, and they came out with, or maybe it was American Cancer, teal. And so they picked up teal as a color, and there was some confusion about that. But I wear my white ribbons, and when I wear them, it's funny because people will say, well, what's that white ribbon for? And I said, for lung cancer. And this person will say, oh, I thought it was pink. I'm like, no,
it's white. No. I have a pair. I remember I actually bought them because of you.
Oh,
I did. I was like, I want to be sure. So I was going to wear them tonight, but everything's packed up in this rental home.
I get it. I
cannot wait to move.
And it's October now, so it is. We called it Pinktober, so a lot of times. And then next month, November, is Lung Cancer Awareness Month. So people can. But look at all the people who've died of pancreatic cancer lately, and that's a really bad cancer. Yeah. And I think it's so amazing that. Justice Ginsburg survived as long as she did. She had 4 different cancers. So she's kind of a hero for a lot of us now, with her stamina. So we should all be so lucky. Yeah.
And I'm actually going to air this in November because I knew that. And I'll make sure I got you in Pinktober because I'm going to air this in November and hopefully get you on a live as well.
Okay.
Just to talk about the month of November and making sure that people know and give more information about lung cancer and lung cancer awareness month and what we're doing, because COVID is still here. So how has COVID affected, I know you talked about now you are now making phone calls versus being in the hospital, but do you know if it's affecting anyone who's in care? Like, are you having the phone calls where they're like, I don't want to go because COVID is,
I think over time, the hospital, at least with UNC, that they've done a really good job on helping patients become more comfortable. A lot of them are not going to the big hospital. They're going to Hillsborough because they can get their treatment quicker. I had a scan done in June, and they actually didn't even take me into the big hospital. They took me over to the ambulatory care hospital, And I was like in right and very careful, and they wouldn't let me wear my own mask. I had to wear their mask. And I was in and out in 10 minutes.
Yeah.
And then, of course, then you FaceTime with your doctor. And in my case, my scan was fine. And my doctor, we talked about my scan for about 10 minutes. And the rest of the time we talked about wine. So I have a really good relationship with him, obviously, after all these years. But a lot of the patients, it's interesting what the doctor has said, though, because when I talked to him, he said, I really don't like doing these virtual visits because I need to see my patient physically. Because I can see so much about how they're doing. And I appreciate it. I mean, he could have talked to me. He knows me so well, and I would have told him if I was having an issue. But he was like, I just don't like this, but some patients do not want to go in, and they have a good system. However, more and more patients are going in now. I mean, a lot of them are going in for their chemo treatments because they have to. So, but I had one patient, for example, and she was going in for chemo, but then she was having radiation 5 days a week, and she was coming from the Greenville area.
Oh, wow.
Well, the hotel, I thought this was amazing. The hotel accommodated her so that, and she wanted to bring her dog. It was kind of a comfort dog for her. So she was staying at this one hotel. They let her have one particular room, and she had it for the 5 days, and then she'd go home for the weekend, and they would sanitize the whole room and not let anybody else use that room.
Really?
Yes. And then she would come back. Now, I don't know if UNC paid for all of that, but they worked that out for her so that she could have that. I think it was like 5 or 6 weeks, and she had that own particular room. Now, to be honest, a lot of those hotels were not making a lot of business. So it probably was a win-win for both, but that certainly alleviated her comfort level as far as, knowing that she had a safe place to come back to and somebody else hadn't been in there, and she could have her dog, which I totally appreciate. So
anxiety is so real. I just had what I consider a scare, and I went to Hillsborough instead of the main hospital. I felt a lump, a knot. I could actually see it through my shirt. And when I was sitting there, my husband was cooking, and I looked down and I was like, wait a minute. Because I didn't feel a lump when I was diagnosed,
Right.
Just to be going. So when I did that, I was like, and I couldn't tell if it was under the implant. It was really weird. And so the good thing about working for PFAC or volunteering and being like the face of so many different programs, when I called, they gave me like a 2-week window before I could come in. And so finally I reached out to my nurse navigator, who's no longer working for my current doctor. And, but she happened to be on call because the nurse navigator was out. And I was look, this is scary. I don't want to bump anyone around, but I know there's space in there somewhere. And I ended up going in the next day and had to have a biopsy. Hillsborough, I was in and out. The doctor was great. And then I had to come back to Hillsborough to get my results. And I was able to see my same doctors there in a smaller setting. And even with, I have to go and get some more scans done, but they're like, we're not sending you to the main hospital. We're going to send you to the clinic to get it done because we don't want you to be at the main hospital. But therefore, the biopsy. But the way it's set up, everyone's helping you to get through without touching anything.
Right.
Which is great.
Yeah. Well, I hope your results are going to be okay.
Yes, everything came out well.
Good.
Everything came out well, and it just brought me back to that place. I'm like, I'm 9 years out, and it was scary because the doctor was like, well, it's a new finding.
Yeah.
What happens with new findings? And my husband couldn't be there, which was so scary because he was always there. But because of COVID, he couldn't be there. I actually got in the car and forgot to turn it on. sweating bullets. Forgot on because I'm up here calling to make my next appointment get in, and they were like, it'll be another week or whatever. And I left there. I went to talk to a friend who's never in town, and we sat for like 2 hours, chatted while she was getting her car fixed 6 feet away from each other. And then I went to my new house and just walked in the woods, walked around all by myself, and came home and looked at my girls. And I was like, I know that this is not it for me. So it's scary every time you go get those scans or you find something, and then you hear them say, oh, it has to go to the tumor board and all. It's so scary.
Oh, sure. Absolutely.
Sometimes
Absolutely.
I feel like it's never ending when I have that break from not getting scans, or I have 6 months or a year. But it's so important that you advocate for your care. Don't be scared not to go,
Absolutely. Yeah. And, on my last scan, I had said to my doctor, I said, okay, I think this is going to be the last one. I'm doing okay. It's 14 years. And I had some bumps along the way. And he said, no, I changed my mind. And of course, and I went, well, why?
Why?
And he said, essentially there's been a spot on my left lung that has been there for 6 years.
Yeah.
And he said it's never changed. But he said, as long as your insurance will still pay for a scan every year, let's keep doing it. And I'm like, okay, fine, that's fine. And I thought we had made this decision earlier, and now he's like, and maybe he just like seen me. I don't know.
That's how I was like, I'm about to hit my 10-year. And then I'm going to keep you for another 5.
That's, what, when you do a clinical trial or anything like that, and you finish treatment and you're like, who's going to be watching over me now?
Yeah.
I want somebody watching over me. So it's okay.
Yeah. My doctor said, if you don't have to see me, you're good.
Exactly.
When I started seeing my practitioner, and I was like, my doctor, where's Dr. Carey at? And finally the scheduler was like, look, Regina, like she really had to say, look, Regina, you don't have to see her anymore. I was like, but I want to.
I know.
But every time she would come in my room.
You probably do, though. You probably do see her,
I do. She still comes in. She's like, you're on the schedule. And the last time right before COVID, my whole team from the beginning, when I was first diagnosed, all came into my room because they hadn't seen me since the girls and all this stuff. And they all came in my room. And I was so overwhelmed by the time I got in my car. I did a little video and I was like, my whole team was there. Everybody from the first person who touched me to the last one, were all there. And they feel like family sometimes. You're like,
and and that's what I loved about UNC. And that's probably one of the other reasons that I picked. And this was 14 years ago. That team came in all together to see me. And that was in the old hospital. That was before even the new hospital was built. Wow. And they all crowded in these little crappy small rooms.
I've seen those rooms.
The oncologist was there. The radiation oncologist was there. A med school student was there. The nurse navigator was there. Because at one of the other hospitals, which I won't mention, I was going boom from every, and it was, when you're diagnosed, that it's like overwhelming. It's just overwhelming. And I so appreciated having that team right there for me. And now that's very functional. I think a lot of hospitals, it's functional that they do that total team approach, which is great.
It is wonderful because I was diagnosed first in Charlotte, and this place. Then they make you go out through the back door of this place when they give you bad news. No one comes. Oh, yeah. When I was diagnosed, we went through the back door that led to the parking deck. Not even the parking deck we parked in. But like, what in the world?
I know.
We shopped around. When I say we shopped around, we really looked at Duke at UNC. And it was actually my nurse navigator that said, hey, you might want to get another opinion. And she gave me the doctors I should look at because my cancer was invasive, but they were like, no, we're just going to give you a new set of tatas.
No. Well, and I think that's really important for anybody who gets diagnosed. If you're in the triangle area, get a second opinion or a third opinion even. And I don't regret that at all. Of course, again, that comes up to the whole insurance issue. Will that be allowed? But I think, again, you're right. We have to be our own advocates. And I told my primary care doctor was the one who actually found all of this. And he said, and he actually lined up all my appointments for me. So I went boom from one to the next. And I so appreciated that. So that was my other advocate, my primary care doctor, who I've had for 24 years. And so we're like, I mean, I have his private text number now. He was mentioned in a couple of things that I have done, publicly for people. So he knows I'm grateful to him too. And it was great because, a lot of the doctors will just say, "Oh, I don't think it's anything. Come back in 6 months." Well, I probably could have been dead by then. So I was lucky. Yeah.
So before we go here, because we've been on for about 45 minutes, tell me where how your journey has led you to be an advocate, to volunteer. Like, why is that so important, or why is this so important to you that you have this give back? Because your spirit is amazing.
Well, I don't. My mom had lupus, and so she was ill for almost, I think, from the time I was 5 years old, and she died when she was 62. But she was always willing to be a guinea pig for treatments and things like that. And so I don't know. I mean, when you get, I think quite honestly, I was so mad I got diagnosed with something because I thought I was leading a clean life, And so when I actually, like 9 months later, after I actually got through all that treatment, I thought, well, I need to give back and let people know that people can survive this. It's not a great percentage right now, but when I was given the opportunity to do it, and it's close by, I just thought, why not? And I love the people that I meet through this and the patients, and it's interesting to see how everybody handles their cancer. But it's something, and I'm not going to say, I will say this. I carry some survivor guilt because I meet all these wonderful people who have the same exact cancer I had, or something even milder, and they don't survive it. And I'm like, well, and I do go, well, why did I survive this? And these wonderful people did not. And the only explanation I've ever heard that made sense was from my hairdresser, who said it wasn't your time. So I thought, okay, well, if it's not my time, then I better do something with this. So I just want to be able to give people hope, and I have the time to do it now. So what is nice too is that people get in touch with me now. Anybody who gets diagnosed with any kind of cancer, they'll get in touch with me and ask for advice. And that makes me feel good, that they feel like I had some friends over the other night, and they said, well, if we get cancer, we're calling you.
You're the go-to person.
I guess. And I'm not an expert on any cancer except probably lung cancer. So, but I can give them the direction to go too.
And I think that's a wonderful thing. That's why you're such a great navigator, because you can give them the directions to look, here's the path. Here you go. And you are like, okay, I'm not going to tear up, and I'm not going to.
Don't do it.
I wish my mom had a person in her corner like you, because when we found out that she was diagnosed, she was actually having surgery, and again, they thought it was bronchitis, and she had all this stuff coming in, going on, and the doctor came in, during her surgery, came back and said, hey, it's lung cancer, and we were like, what? We have to do a trach. And we're like, what? And we were so left in the dark. And they were like, you have to do this treatment, that treatment, but she's going to die, And it was like how they said it. I knew then that I was going to advocate for my care no matter what, whether I was sick, whether I was just for my primary care physician, knowing which one to pick. So it was very important. And the way the doctors actually, talked to us, it just made no sense for a family hearing those words. And
right.
I already lost my father, not even, 6 months before then. And then we lost it was about a year. And then we lost my brother. So we had been dealing with death and dying. And I just wanted to change it. And when I was diagnosed, I know my family was like, oh my goodness, here we go. I was very private, even with my family, because I wanted to do it a little bit different. I wanted to make, I advocated for my care, that my husband was a great cheerleader for me. And you have to make sure that you have all those components. And if you don't like what you hear, get a second opinion.
Exactly. Exactly.
And that's what I did. I got a second opinion, and I was able to meet great people. And I love the work that you're doing. I've seen you going in the rooms. I've seen you out in the lobby. I've seen you advocate for a coffee cart or something for the patients. And that's a beautiful thing, because we've been there. We've sat on the other side where we're sitting for, I don't know how long your chemo treatments were, but sometimes my wait was longer than my treatment.
Oh, yeah. Oh, I agree. Yeah.
And the thing that you've done with the PFAC committee has really shortened the time of those waits. And they've made the patients very comfortable, and they know you.
Their whole system at the big hospital has really changed, because a lot of times now, you go in and you have your lab work, and you see your doctor, and then you have a scan, and then you have to have chemo too.
Yeah.
You're there from 8 a.m. till 5 or 6 at night. Yeah. Now they let you have your scan a day or two earlier and all of that. And that has really, because really it is, you have the scan anxiety on top of it. Mm-hmm. And then sitting and waiting to have your chemo treatment. And so, I totally get that. So the hospital is really working hard on that. And I love seeing that. And and if a patient will come in and they'll check in for chemo, and they'll say, well, you probably won't be able to get in your chair for an hour. So they take their cell phone number and say, go get lunch, or go do this, or go do that, which is fine, instead of sitting there in that room going, when am I going to call my name? So there's a lot of good things happening. Yeah.
Well, you've been a part of those good things happening.
Well, I'm happy to be there. I'm happy to be able to give back a little bit. And it's a great hospital and a great group of people there. So we're very blessed to have that so close to home. And I can't wait for you to get in your new home.
I know. I'm going to be doing more podcasting, more lives. I was hoping that I would be in my new home when we set this up, I think early September.
Yeah.
I'm not.
Now you got to go pick a new carpet color.
I know. If you only knew.
Oh, well, we just were changing it out in the house here, and it took me forever to find the color that I wanted, because
so hard.
Oh my gosh, the samples and all of that. And you just, it's like, and so I think I got what I like, but it's really interesting. It's almost two-tone, because sometimes it looks gray and sometimes it looks a little more brownish. So
the same thing. But it looks a little brown. And finally I told my husband, I don't care.
Yeah. At some point you're like, I'm done.
I'm done by this time. I'm done.
Just put it in.
Well, but I am so happy to have you on my podcast. I'm going to actually air this in November, because I wanted to make sure that we designate that month, not just that month, but I want to kick November off with a bang. And I hope to have you on my live podcast. And
that'd be great. By then my carpet will be in.
Hopefully I will be in my home, in my little pod. I actually have
Yeah.
podcasting closet that I call the pod. So I'm looking.
That'll be great. All right.
But you stay on there. Thank you so much. Remember that the glow doesn't define me. I define the glow.
Sound editing is provided by Josh Masters. If you like what you hear, please rate and review the podcast in iTunes. Connect with Chemo Glow on Facebook, Twitter, or Instagram. You can also find more content at chemoglow.com.